Good morning everybody. I am Dr. Ravindra, consultant gastroenterologist, hepatologist from BGS Global Hospital. 28th July is World Hepatitis Day. This day is very important for us because India has lot of these hepatitis B patients and hepatitis C patients. At least 100 in a 100 population, at least 5 of our people are hepatitis B positive and 1 is hepatitis C positive. And especially in northern part of India, it is up to 2 or 3 in every 100. Why we fear about hepatitis B and hepatitis C is because of 4 reasons. One is hepatitis B and hepatitis C will spread among the family. Just to give an example, if an husband has got an hepatitis B or hepatitis C, it will spread to the wife, from wife to the children. That's why this becomes a big circle in the family. Second problem with hepatitis B and hepatitis C is these viruses will eat the liver. Slowly the liver gets damaged and then liver goes into failure. This condition is known as liver cirrhosis. And third important thing is hepatitis B and hepatitis C cause liver cancer. Means why we, in a nutshell, if I have to tell, hepatitis B and hepatitis C are danger for 3 reasons. It causes liver failure, liver cirrhosis, and then it spreads in the family. And next thing is, do we have a treatment for hepatitis B and hepatitis C? People used to think that there is no treatment for hepatitis B and hepatitis C. Please note that there is a very good treatment for hepatitis B and hepatitis C, and both of it can be almost cured now. And most important thing, the patients come with hepatitis B and hepatitis C is, the third question they ask is it AIDS or is it HIV? Please note that hepatitis B and hepatitis C is not HIV or not AIDS. This is a totally different thing. But be aware that hepatitis B is, the spreading is much faster than HIV, because HIV needs 0.03 ml, whereas hepatitis B needs 0.003 ml. That's why this is a very important thing. It is not HIV, but it spreads much faster than HIV. And fourth important thing is, the usual question people ask is, how do we treat this? There is a very good treatment for both hepatitis B and hepatitis C. We check the liver function and we see that whether the virus has gone to the liver. Second thing is, we do an ultrasound abdomen and then we check specifically for DNA of the hepatitis B, and in case of hepatitis C, we check the genotype of hepatitis C. That means which is the type of hepatitis C patient is infected, and finally the RNA of hepatitis C. Based on these tests, we think of treating these patients. And what are all the treatments we have for hepatitis B? There is wonderful treatment for hepatitis B. We have interferons which are given for an year, and then we have entecavir, we have tenofovir for hepatitis B. And second thing is, for hepatitis C, we have a very good treatment, that is pegylated interferon and then ribavirin. This is given either 24 weeks or 48 weeks based on the type of hepatitis C virus the patient has. And most important thing for the patients, one more thing for the patients they ask is simple questions. What are those simple questions? Hepatitis B and hepatitis C, can they get married? Yes, they can get married. Only thing is, the partner has to be informed and partner has to be vaccinated in case of hepatitis B. And hepatitis C, if suppose boy has hepatitis C and girl has no hepatitis C, even if they get married, there is a very less chance that hepatitis C spreads to her. This is one thing. But in case of hepatitis B, please note that the partner has to be informed and then partner has to be vaccinated so that the hepatitis B doesn't get. That means both hepatitis B patients and hepatitis C patients, they can get married. The second thing they ask is, can they have children? Very important thing is, both hepatitis B and hepatitis C patients, they can have children. Only thing is, in case of hepatitis B, if the partner, means especially if the female partner, if she has a virus, then we treat at 6th month so that the virus does not go to the child. And then third important thing is, can it get to children? Usually if we give vaccination and if we give treatment for the pregnant female, it doesn't go to the child, so that hepatitis B doesn't go to the children. And finally, how do we prevent hepatitis B and hepatitis C? Please note that hepatitis B and hepatitis C can be prevented. It is better that you don't get the virus and then you don't come to us, rather than you please protect your own selves. That should be the motive. The thing how we should do is, every one of us should test ourselves and then we should get vaccinated for hepatitis B if we are adults. And then all children, that means newborn babies, they should be vaccinated with hepatitis B. This is the very important thing from where we can totally prevent hepatitis B and hepatitis C. And one word about hepatitis B and hepatitis C. What are all the precautions in family if somebody is hepatitis B or hepatitis C, how they should behave? Please don't segregate them like HIV or AIDS. It is not HIV or AIDS. And then hepatitis B and hepatitis C, people can be there in the family, they can live normally and they can be normal. And then they need not be separated, they should not be kept in a separate room. The shirts, pants, they need not be kept separate. The utensils and then the eating plates, they need not be separate. These discrimination should not be done. And then because this is not HIV or AIDS, there is a very good treatment for hepatitis B and hepatitis C. On this World Hepatitis Day, we should really think that this hepatitis B and hepatitis C is controllable, curable, and then if we take vaccination, hepatitis B can be prevented, and that should be the motive. And please don't discriminate hepatitis B and hepatitis C in the family. Thank you very much.